Good morning, Illini. Welcome back to another Healthy Illini podcast. I'm your host, Matt Schrock, and we are glad you are with us. We're doing a little bit of a different series, starting a little bit of a different series here with meeting some of our McKinley staff. So I'm really excited to have this conversation and have you listen in. Today we're talking with Kim Smith. She's been on the program before. If you go back in our archive and you look at the smoking cessation podcast episode, she was here speaking about that. But today we're talking about Kim specifically. And Kim is a nurse practitioner here with our women's health department. She's actually been with McKinley almost 20 years now. We're coming up on 20 years. But Kim, thanks for being here today.
Oh, well, good morning, and thank you for having me. I'm excited always to get an opportunity to talk about McKinley, and now I'm going to get an opportunity to talk a little bit about myself.
Well, I'm excited about that because, like I said, we're starting this new series, and the idea is just to kind of get to know the staff in a more personal way than just
Sure.
a provider kind of idea or your medical facility staff kind of idea. Want to learn who they are, who their stories, what their stories are. So let's just kick it off with your starting point. Let's just basic question. How'd you get into medicine, and was that something you always thought you would do?
Well, it's kind of interesting because my initial undergrad degree is not in anything healthcare necessarily related. It was in social work. And I always envisioned, going from my bachelor's to getting master's in social work and kind of working as a therapist. And after graduating, I had some things happen in my personal life that kind of delayed going to graduate school and started a health educator position with Planned Parenthood. And that's where I really got to learn a lot more about healthcare. I also got to learn more about the nurse practitioner role and was really fascinated with that, could see that being a good fit for my interests, my personality, and all of that. So ultimately, I went back and got a second bachelor's degree in nursing and then completed the family nurse practitioner program in 2002.
And you did that in ISU, correct?
Yeah, at Illinois State. Yep, I did all three of my degrees there. And when I was in the nurse practitioner program, it was still relatively new there. It's grown a lot. It's now a doctorate program. But it was a very good experience. Lots of good clinical experience, wonderful faculty. It was good.
And why did you, when I was looking over your prep work, you said you ended up going through becoming a family practice nurse practitioner. But why that specific focus?
Well, my interest in healthcare has always been in women's health, but I also liked the flexibility. Doing family medicine, you can work in pretty much any setting. And so I also had some interest in dermatological conditions and patient education, patient teaching with chronic disease like diabetes and that sort of thing. So I just felt like the generalist route was the way to go for me. And I'm glad I did.
You said that dermatology cases and dermatology ideas are something that was really interesting to you. Why was that? Is there something that just you enjoy like figuring it out, or?
Well, I struggled with acne myself, so I have a big passion for helping people clear their skin. And, just the whole process of eczema, psoriasis, all the different, I find it challenging. A lot of times, folks have maybe seen other people for very brief appointments in the past, and they really haven't had a chance to get into a lot of their story in terms of their skin concerns. And so I think it's kind of just grown from there.
I think that's a really important point you bring up, though, that you have a passion for it because you have some experience with dealing with dermatology issues and things like that because of acne. And for a lot of us, that's where we find our passion, is something that we've interacted with before, that we understand, we know where somebody's coming from because we've gone through it before.
Absolutely. And I would right now, most of my time, about 70% of it is in women's health here at McKinley. 30% is in the medical clinic, and the vast majority of those appointments are people with skin concerns. And, it never gets old. I've been doing it pretty much I'll be at McKinley, 19 years in July. And, that's been an interest and a passion of mine since I came here, and it continues to be. It never gets old, right?
Let's backtrack a little bit because you said it's been 19 years in July. What brought you to McKinley? How did you end up here? Was it something that you're like, oh, I want to work at that place, or was it kind of like fell in your lap kind of idea?
Well, it's interesting because when I was a nurse practitioner student at Illinois State, I did clinicals in their student health center, and I really enjoyed the college age population. And so when I first graduated from nurse practitioner school, I worked in a family practice office. So I really saw everything from newborns to, people in their 90s, close to 100 years old. And I felt like my niche, my fit was really working with young adults. And so when a position came open here, it just seemed like a perfect opportunity to make that transition.
But you didn't start in women's health, correct?
No, actually, when I first started, I was almost exclusively in the medical clinic. And it's just kind of gradually over time, my hours in the women's health clinic have increased. And so it's kind of nice because, it's like I started my career in women's health as a health educator, and now I'm getting towards the end of my career and I'm kind of back doing more women's health. So that's kind of cool to me.
So over that scope of years, what changes have you seen? I mean, you have had to have seen a lot of shifts in not just how McKinley operates or how the service is offered, but also in medicine.
Oh,
just in
wow.
how things
Yeah, it's
go.
like, where do I begin? So let's kind of hit maybe some of the highlights. So the big thing has been the introduction of the electronic health record. If you think about when I came here in '04, we were either writing notes and charts, paper charts, or we were dictating. There was no electronic health records. So that has been like a major change. And it's had its pros and cons. I think overall, in terms of patient care, it allows information to be consolidated much easier, to have everything integrated better. So I think in that regard, it allows patients to have access to medical information very quickly, to be able to schedule, appointments online. So that's just been huge in terms of the big change. The other thing, and I think it was kind of in its infancy before the COVID pandemic, but telehealth. We went almost exclusively for a while to telehealth during the height of the pandemic, and that was huge. That was another big change that I don't think we would have envisioned 20 years ago necessarily. And it still has its place. I mean, I think that we're finding, at least here, that a lot of folks do prefer coming into the clinic, meeting with people, in person, but that option's still there and it works well, particularly with mental health patients a lot of times, health education, those types of settings in particular. So I think that's definitely here to stay.
Well, you did say, two things you talked about are technology, and if to me it feels like, and I could be wrong, correct me if I'm wrong, but it feels like the technological advances are coming so rapidly. You think about the change from 2002 to 2012, things like electronic health record type things, those kind of came along. It felt like it came along kind of slowly, but once we got there, then the next thing came faster, and then the next thing came faster. And when telehealth came, it was real quick because we had to.
Absolutely. I was just talking with a colleague this week about even 5 years ago, things looked so different here than they do now. It's kind of amazing to see really all the changes. The upgrades with trying to kind of, I guess, meet the students' needs where they're at. And I think that's going to continue to be, a focus. I think we have very forward-thinking administration at McKinley right now, and I think they're looking at ways to continue to better meet the needs of students. And kind of to circle, back around about that, I think another big change has been the emphasis on the whole person. I think that we've kind of moved from maybe the model of, health is absence of disease, right? That used to kind of be the thinking, to health encompasses a lot of things besides your physical health, the mental piece, the emotional piece, the spiritual. and how we kind of integrate those together, because we know they all affect how you feel physically, right? And if how you define yourself as being healthy or not healthy. And so I think that's going to continue to be an emphasis in healthcare.
Well, and you talked about it when we were talking about how you started, that you initially were thinking social work, and then you kind of pivoted to healthcare at the time, because they were kind of separate in a lot of ways. They're not as separate now.
No, and it's interesting, and I think that's part of the reason my social work background combined with my nursing background is probably why I enjoy doing what I do so much, because I get kind of the opportunity in some ways to do both.
Yeah,
you know,
there are skills that come from both of those for sure.
Absolutely. And so, yeah, and I you're right. You know, I started college a long time ago, right? So they were very separate then. And you're right, there's a lot of overlap.
And I think that's really just a huge asset for us here at McKinley. I mean, I've seen you in the clinics. I've talked to you a number of times, and you can just see that there's a talent and a skill set there for using both those sides to reach college age, because that's real. Because college age seems to be that transition age when it comes to healthcare, that treating the whole person is such a huge deal, because anyone who comes in here and has any kind of physical need from a disease standpoint is also dealing with the first time going on their own to the clinic. They're figuring out their own. Mom and dad aren't taking care of everything for them anymore. They're living under their own authority kind of idea.
Yes, this is kind of their initiation, so to speak, to navigating healthcare, right? Yeah. And so we want McKinley to be a warm, welcoming place where people feel comfortable coming in and getting their healthcare needs met. We have a lot of services here, and that's, if there's one thing that I could really encourage folks, it would be to take advantage of all the services. I mean, we have a medical clinic, we offer gynecological care, we do travel medicine, we have mental health, health education, which offers, stress management, nutrition services. There's just so many things we offer here. And it's always interesting, because every now and then I'll come across somebody who has maybe the last semester of their senior year and they're graduating, and they're like, wow, I wish I had come in before. They really haven't had the need or maybe the experience with using McKinley. And so that would be something I would really encourage folks to take advantage of the great services we have here while you're a student.
Before we close this episode, I do want to pivot just a little bit, because one of the reasons I wanted to do this was to give people an opportunity to get to know our staff. Like, I live in a small town. I go to the grocery store. I see the same cashiers all the time. I go to the restaurant. I see the waitress, and I know them in that setting, but I don't know anything about them outside of that setting. And they have a whole life. Sure. And so people come here and they see our providers, they see our clerks, our nursing staff, whatever, and they see a very small portion of who we are. So I would like to know some things about you that have nothing to do with medicine, have nothing to do with your job necessarily, like your hobbies, what your interests are, things you're passionate about outside of McKinley. So I'm just going to kind of give you a blank check on this one, to share a little bit about who you are.
Cool. So actually, I grew up in Illinois. Didn't grow up in Champaign. Actually lived in Bloomington for a large part of my growing up years. And so I'm an Illinoisan through and through. I have kind of some interests that probably fit with being in healthcare a little bit. I'm trying to practice what I preach, so to speak, more with trying to eat, healthy, do more home cooking, trying to get into exercise. I think that's important for everybody. In terms of outside of those type of things, I'm a huge football fan, both college and professional football. So during the fall into, the winter, that's a big thing that I really enjoy.
So I got to ask, favorite teams? I mean,
well,
hopefully Illini's on there somewhere, but.
Absolutely, yeah. With college football, of course, I enjoy watching Illini football, and I'm excited about the movement the direction we're moving in. In terms of pro football, you can't be from Illinois and not be a Chicago Bears fan, right? So, and I'm optimistic about their season. And then I also like Cincinnati Bengals. I'm a big Joe Burrow fan.
I think that's a requisite of Bears fans too, that we all love our Bears, and then we have our comfort team on the side that we have to kind of follow.
Yes, that we think is more likely maybe to make the Super Bowl, right?
That gives us a little bit of joy on Sundays sometimes when the Bears aren't playing so well. But
yeah, and I enjoy spending time with family. I'm a big reader. I mean, reading has been for me from the get-go practically. So yeah, probably I'd like to get more involved once I retire and have a little more free time down the road, maybe more involved in some community service and that sort of, thing. That it's kind of hard to balance all that.
Oh yeah.
Well, with working. But yeah, that's also an interest of mine.
Well, and that's what I wanted to just kind of touch on, is that there are things outside of McKinley that we all do. We all have our own interests there. And somebody may come in and have no idea that you're a huge football fan. But now they come in and they're like, oh, that's Kim. That's the one who likes football. And they can mention something. And we both know if they start talking football, your 15-minute appointment might turn into 30 minutes as Kim's talking about all the things
Absolutely.
that she loves.
I had a patient, it's funny you say that, in women's health this past spring who had a Joe Burrow jersey on. So, right? So that led to a whole other conversation.
For sure. But, it helps to remember that that the people here at McKinley are people with other interests, and that there's ways to connect, because we talk about it on this program all the time, that everyone's unique, but there are commonalities. And finding those commonalities sometimes can be the support that you need when you're going, even if it's in an appointment there, just feeling that connection to your provider, that connection to the staff can help put you at ease when you're trying to navigate this new journey of your own personal health care.
Absolutely. And I think we have most of the staff, if not all the staff here, are very easy to relate to in terms of providers, and we kind of all have our individual interest and that sort of thing. But at the end of the day, we're here for the patients. We've had a lot of long-term folks here, right? That this is a good place to be.
Okay, I appreciate you taking the time to talk to us today and sharing a little bit of your story. I've really enjoyed it.
Thank you, Matt. Thank you for having me.
When you come to McKinley, you're going to come across staff who are very good at what they do. They are educated. They are up to date on things when it comes to health matters. But there's also sides to them that you might not see, and some of their personality. And hopefully we can highlight that as we go on to help add a comfort level when you come in, that that you're talking to somebody who does care and has passion about what they do, but passion about other things in life, and that connection can make it easier to come in and talk to somebody when you are having an issue. If you have any questions about what we do at McKinley or our staff, or just want to continue the conversation, please reach out. Let us know. Reach out to us here at Healthy Illini. We'd love to talk to you about it, get your feedback on what you think of the episodes, what you'd like to see from the episodes. But really, we just want to help make this interaction, this relationship with McKinley, as comfortable and as easy as possible. But thank you for joining us today. You're on a personal journey, no matter where you are in it. You are important and you matter. Your health and wellness are important and matter, and we're here to keep you well to excel. So go have a great week, Illini. Let us know how you're doing, and we'll catch you next time on Healthy Illini. This week on Healthy Illini, we're getting to know some of our staff, and we're starting with Kim Smith, who is a nurse practitioner with Women's Health. Kim, what's one takeaway you would like listeners to have from this episode?
Yes, I think the biggest takeaway would be McKinley offers an array of services, and we're here for you. Take advantage of all the stuff we have available.